Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about colon polyp. We are going to see what is colon polyp is and how many types of colon polyps are there and symptoms of it, causes, complications, tests, treatment and precautions. So let's get started. What is colon polyp? A colon polyp is a growth on the inner lining of your colon or large intestine. Now let us see the types of colon polyps. There are three types of colon polyps: hypoplastic polyps, adenomatous polyps, and malignant polyps. Hypoplastic polyps. Hypoplastic polyps are harmless and don't develop into cancer. Adenomatous polyps. Adenomatous polyps are the most common. Although most will never develop into cancer, they do have the potential to become colon cancer. Malignant polyps. Malignant polyps are polyps that are noted under microscopic examination to have cancer cells in them. Now let us see the symptoms of this condition. Most people with colon polyps do not have any symptoms. However, some people with colon polyps may have change in bowel habits, constipation or diarrhea that last longer than a week, change in stool color, iron deficiency anemia, abdominal pain, and rectal bleeding. Now let us see the causes. Normally, cells grow and divide in a specific way. Polyps may happen when cells grow and divide more than they should. Anyone can get colon polyps, but certain things make you more likely to have them, including if you are overweight or obese, age is 50 or older, smoking, have had colon polyps or colon cancer before, have an inflammatory bowel disease like ulcerative colitis or Crohn's disease, have type 2 diabetes that isn't well controlled. Now let us see the complications. Complications of colonic polyps include bleeding, obstruction, diarrhea, and the development of cancer. Now let us see the tests. Colonoscopy, a procedure in which a long, thin, flexible tube is placed through the rectum and into the large intestine. The tube has a camera that shows images on a screen and allows the polyps to be removed. The next test is the flexible sigmoidoscopy. This test is similar to a colonoscopy. Your doctor puts a thin tube with a light into your bottom to look for only at the lower part of your colon. If you have a polyp, they can remove it during the test. It takes about 20 minutes. Next test is CT scan, a radiology test that uses radiation to create pictures of the large intestine. Next test is the stool test. You provide the lab with a stool sample which will be tested for blood or genetic changes suggestive of polyps and cancer. If the test is positive, a colonoscopy is needed. Next test is lower GI series, also called barium enema. Before this test, the radiologist will fill your large intestine with a chalky liquid called barium, which makes your colon easier to see during an X-ray. Now let us see the treatment. Doctors will usually treat colon polyps by removing them. Doctors can remove colon polyps using the following methods. Colonoscopy. Doctors can use a cutting instrument or an electrified wire loop on the end of a colonoscope to perform a polypectomy or polyp removal. Laparoscopy. During laparoscopy, doctor will make a small incision into the abdomen or pelvis and insert an instrument called a laparoscope into the bowel. They use this technique to remove polyps that are too large or cannot be removed safely by colonoscopy. Proctocolectomy. Removing the colon and rectum. This is only necessary when a person has a severe condition or cancer. Doctors recommend this option for those with rare inherited conditions such as familial adenomatous polyposis. Now let us see the precautions. Avoid excess alcohol and do not smoke tobacco. Lose any extra weight to normalize your body mass index. Exercise regularly. Eat at least 3 to 5 servings of fruits and vegetables a day. Avoid fatty and processed foods and red meat in excess. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.